Yeah. And I just took out food. And so it's a little steep. And actually, I'm going to close the window. I was trying to air it out.
Does he have the room with the carpet?
No, actually, so Jane's house flooded.
Yeah.
So she moved in there to that house temporarily.
I don't know that house.
It's in Fort Langley.
Oh, okay.
That's where we were gonna move, but then.
Oh, okay.
So, you know. Oh, honey, mama.
You need your breakfast too.
So,
I have a, what do you call it? I got a clipboard.
oh,
Oh, yeah. Okay.
hi, mama. Let's see. Oh, let's turn up that sound. All right, sound is being turned up.
Nice kiddos.
So,
Gosh, she looks significantly smaller.
I know, isn't it amazing?
Look at that.
Without all those babies in there.
You are almost ripped, Mrs.
And her bald spots are going away.
Yeah.
Here's some floor blankets.
So I saw that somebody did a wonderful map, you know, of the kittens.
Uh-huh.
I did not memorize it.
I will help. I will help you. Light. They're so big, and they've started responding to sound, and
All these things at 2 weeks, of course.
eyes are open. You can sit on this if you want. Unless you want to share.
No, I'm totally fine on the floor. Actually, the harder the better.
Oh, okay. All
We're
right.
good.
All right. And hello. Oh my gosh, you guys are really adorable. I should post that you're here. Hello. Hello. Oh, you're affectionate. Hello. You may get some
too?
exciting hisses.
Oh, hey, Spunky.
Oops.
Hello. Is that you?
It may be one of the cats trying to go to the bathroom.
Oh.
Right. I'm going to post.
Is it the 28th?
It's the 29th today. Okay, which is ridiculous, I know. Here's one. Facebook doesn't let me tag you anymore until I'm like in the post, and then I have to go back in and edit it, and then I can tag you.
Is that what it?
It's so weird. Like another Mountain View Veterinary Hospital comes up unless I've already posted it, and then the right one comes up.
Because I've had problems whenever of me trying to tag things when I post it. Is that why? Because I feel like I didn't used to have problems.
I know. Yeah, they must have done something.
Let's see.
All right, posted. So, let's see, the feed is up and everything. Let's see.
I'm gonna come over here. You gotta check out my stuff first. Check your stuff out.
She likes to keep herself clean.
No, I know.
So, and the babies.
Should we peek at you since you're here?
All right, let's do a.
I'll come closer to you so that you can sort of hold her. That's
She's very nice. She's a whole different experience.
She has a baby.
No. What a good mama.
I know. Can I see? What a good mama. I haven't got to meet her too much because Dr. Henderson left her.
Oh, goodness.
Come here. Oh, I don't know about the teeth. Maybe we'll do the teeth at a different time. She's a bit of tartar. It wouldn't hurt to put a scaler over top of your teeth when you get sprayed.
Oh, a scaler. Isn't that fun? So,
just have a peek at you. I know. Just give you a good head to toe since we're here, hey? You keep purring.
she has very special giant ears. Can you guys hear okay in the chat?
Good. Can you peek in this one? Oh, good girl. You have good ears.
Special ears. So for anyone who doesn't know, this is Dr. Ferguson from Mountain View Veterinary Hospital near the Willowbrook Mall in Langley.
She can face you now, which she'll like better because you're her friend.
I am her friend.
And doula.
And doula. Right, Mommy? Oh, you're going to need to stop purring a little bit. What a nice mama. What a nice mama. Oh. What a nice mama. What's your baby? What are you doing over there? Hmm?
She's in bed and not sneezy or anything at all. Right?
Mm-mm.
She sounds really good. You have quite the motor.
Mm-hmm. She's a purr.
Good girl.
She used to be completely bald there. She's growing back.
Yeah.
Much less itchy.
Little fleas.
This happens from the revolution leaves.
Sometimes, in a very small portion of them, they get a little bit of temporary hair loss or what's called alopecia there. It's not super common and it's very forgiving, and I think it's still worth using. If she can sort of stand up, like on her four legs a little bit,
okay.
it just puts things in a little more because she's a little fuller than the average. Okay. I found your kidneys. They're where there should be.
That's good. Yay. Good kidney.
Extend my leg.
Do you feel the
Giant bladder?
Oh. Hey, Mama.
A colon?
I actually didn't feel her this morning. She's got poo or whatever the lump. Hey, Mama. What's going on?
Good girl. She probably doesn't appreciate with her full bladder me moving things around gently.
Good girl. What a good girl. Hmm?
Has she had any discharge from her back?
Mm-mm.
Like not for like a week or so.
Yeah.
I don't feel anything abnormal in there. What it can do is, while we're here looking at the kittens, hopefully she'll go have a pee, and then I'll be able to feel a little bit more.
Okay. You would feel it like it was.
Nothing feels abnormal to me for her being, like her uterus. I can barely feel it.
Okay. Good.
Which is good. And I'm having to be Her bladder's like this big right now.
Oh, time to go.
Hey, stinker pot. There you go. Go. Good girl. Go have a potty break.
She's like, but there's food and there's babies and there's pets. I don't think.
I said I'm gonna eat.
First things first. Do you need a towel or anything?
Do you have a? I'm fine. I can roll or change my pants. Do you know a weight on her?
I think she was around 9 pounds, but I don't actually. Did I write that down? I think it was like 4.1 kilogram. 4 point something. Tell me to plot that on there.
She doesn't mind. Just let me have the postpartum weight.
Postpartum.
Like it should be without a big uterus, however big bladder.
This one's 4 points.
That's okay. 4.07. Be fun. We can weigh her if she has a pee afterwards and see what the difference is. And she goes down. Well, she'd go down to 4 for sure, maybe to the 3s. Who wants to come?
Oh my goodness. This is the littlest one, Jitterbug.
Hello,
he
nice
was
to meet you.
Teeny tiny when he was born.
Hello, hi. You're very adorable. I'm not going to look in your ears because that will be a bit. We could kind of just have a little flash at those eyes.
His eyes just finally opened yesterday.
Today you waited so I can have just a general peek. Oh, bright light. Bright light. They look pretty good. Won't be too mean. Can you say ah? Oh, very nice. Oh, look at that. Eh? Nice work.
And they all have it. Well, not all of them. Most of them have this little scaly patch on their forehead. It doesn't. I mean, it's not bothering them or anything. I just thought it was interesting to note.
It is interesting.
Almost all of them had it. I didn't know if it was something like how babies get that.
I have never seen that in kittens. And probably, if it's not, it's probably just keep an eye on it.
Or I thought it could maybe be from wacky paws at the milk bar.
Maybe.
But it seems more flaky.
It doesn't look pathologic, yeah. It doesn't look like skin disease or the skin
And it's
itself.
all in the same spot.
Isn't that funny?
And nowhere else.
Is that your tummy? Oh, I feel 2 kidneys.
2 kidneys.
That's how many you're supposed to have.
That's important.
Oh, I know. No hernias so far. I'm not going to try to find any boys yet. It's too mean.
He's the best one at being handled so far. Some of them are very squawky. Oh, that's so cute.
You can go back. I can find nothing wrong with them. You
Yay!
should keep them.
I will.
You want to weigh them today, or did you already?
Oh, I haven't actually weighed them yet this morning, so maybe I will do that on the way in. Where's my... So, yesterday he was 247 grams. Where you going, buddy? Today, 260. Good job, little bug.
Yeah. You're a good girl.
They're like 2 ounces smaller than the cupcake kittens were at this age.
Good morning.
This is Foxtrot.
What made you pick dancing?
I don't remember actually. It was one of those late night. I thought there were some cute possibilities.
Mm-hmm. Hello.
And I thought maybe we could get on Ellen because she likes to dance.
Can I peek one more time in your little mouth? Oh, it's very cute in there. It's fine. Let me see your eyes. Come here.
He's scandalized.
So that was a mean, dirty trick, but your pupils work. Isn't that awesome?
That is awesome. That is awesome. Hello, Foxy. Foxy Fox. Oh my goodness.
Coming to say hi.
Tell him it's okay.
Sounds good amongst those squeaks. No heart murmurs so far. Yay. Let me feel your tummy gently. Okay. 1, 2, good. You have to pee like your mom. You're very cute.
He's got a little crust.
Yeah, isn't that funny? Here you go, you're a keeper too.
How pudgy he is. They're always shaped like toads with their little bellies. All right, salsa. Oh, let's weigh him.
Oh, sorry.
Okay. Oh, Foxy. 333.
And Gingerbread is a girl?
Boy.
Boy. He's a little boy.
I know, teeny tiny. He's gained almost 200 grams.
Wow.
Well, 180 grams. He was only 79. She's a hugger. I think cute. She likes to smoosh the babies.
It's like a little bouquet.
I know.
Like it's because it's so colorful.
I know. Very special. I'll take this one out. Maybe I'll weigh him first so I don't forget. So Foxtrot was 333, up from 317.
Nice.
Salsa is 310, up from 301.
Salsa is a boy or a girl?
Boy. Boy. Oh boy.
Good morning. Good morning, little guy. How are you? Oh, you're so cute. Yeah. I'm so nice. What do you say? Yeah. Very nice. Oh, I did bring. Did you deworm them yet?
No, I haven't.
Okay, I have it in there.
I have some straunch left over from cupcakes. Does it go bad?
Not really. Not if you're clean with it. But I have some nice names. Oh, they're 2 weeks. Let's deworm them.
Yes.
I can always tell you guys from rescues that come from the street because you're so much better health by the time it's a spay and neuter time. Nice and plump, and they actually have muscle because worms haven't been draining their resources. Taking care of them early. It's lovely. 2 kidneys and a little bladder too.
So cute. Oh no, that's okay. I'm just adjusting the camera. Oops.
I know I'm sorry, Squeak. Oh, you're good. You're good. There you go. I'm going to say hi to your mom. 312 for Lindy, up from 297. If anyone has questions, you can ask them in the chat. Good morning. Can I see you? Come and see me. I'm sorry, you match. We're dressed the same today.
Do you want me to hold her?
Good job. Good job. It's hard to take too much about their eyes right now, but they look pretty normal. There's no red flags.
And you're checking for pupil
Just their
response.
pupils, yeah. Because sometimes they're born where there's like persistent pupillary membrane, where their pupils don't form properly, or there's adhesions or obvious cataracts.
Oh.
And you can see obvious abnormalities at this point, but not really subtle ones. And I don't want to just shine the light in their face.
Yeah. And it's normal that the pupils are always like
A little
totally pointing in weird directions.
at this age. They have to train their little muscles where to go.
Because when I take pictures and post them, they're always like, and I'm like, oh.
That's what I looked like when I was little. People were concerned. Red hair and the eyes getting all wacky. You guys will be fine too. Don't let them tease you.
So brave.
So your eyes have to get strong.
Someone's asking if they can come work for you.
Pardon me?
Someone's asking which, or if they can come work for you.
They might want to check what the rest of the team to see what it's really like. No, it's good. We ate a lot of snacks.
Is there a cat at the door? Oh,
Good.
there was apparently a cat at the door. It could be anyone. There's no one there now that I can see.
When I went to go grab something, they were all three.
Oh, they haven't had their breakfast yet. Well, they probably had it by now, but they hadn't. Plus, it's exciting in here. Exciting things happening in here. They like to be part of all excitement in this household.
Oh, you guys are just so perfect. Good job.
Aren't they
Good
so
job.
cute?
You're growing up so well. Little monkey.
Cute and special.
Yeah.
And Dr. Ferguson got to meet Tango's new family.
Oh, yeah. They're wonderful. I haven't seen Tango yet, though. I think soon. Maybe sometime this week.
That will be fun. $3.25 for Hula. This is our big girl.
This is the one Sharon in our office
Yes.
keeps thinking is very funny.
Yes. And she's floofy too. Do you think she's floofy? She's extra floofy. I haven't had a lot of floofy kittens, but the few I've had,
Well, if you blow dry it and keep working, it's like that.
I'm trying to make her more floofy. She's been exploring out of the nest twice now. The first time was like her first week, and she climbed back in on her own because Calypso was not concerned.
Are you okay?
And
Are
then
you adventurous?
She is. And then yesterday, she had a little puffy fat tail. It was so cute.
Oh, you don't know where to focus when you put that braid in my eyes. It's good though. Are you gonna have some catitude? Yeah, that's okay. I like that.
Wow, there are 960 people watching. I should do the spiel. So this is Dr. Ferguson. She's from Mountain View Veterinary Hospital. It's mvvet.ca if anyone is looking for an amazing vet. She donates a ton of her time and services to laps and to tiny kittens. And as you can see, she does house calls, which is amazing because then we don't have to stress the moms to bring them, to pack them up and bring them in for checkups. So that's what's happening now, a 2-week checkup. And
just making sure everybody was born with all the right parts and they seem to be functioning and growing the way they're supposed to.
she's the one that I'm always texting during the labor or during the delivery and always asking questions to and sending pictures of poo and tapeworms and things like that. So it's a big help to be able to have someone who will answer questions and also help educate us about what to do.
Good job. It sounds wonderful. Yay. She looks great. You're very cute. Can I check your tummy and make sure your belly button's where it's supposed to be? Come on.
She's one of the ones I had to cut.
Oh, you did a good job. She'll be wearing a bikini. You will. I know. Not one of those low-cut ones, though. Who are we missing? This one. Right?
Mambo, yes.
Little Torty.
Yes.
Oh, come here, I'm sorry. Oh, no. Oh, we didn't weigh. Did we weigh him?
Yes,
Yes, we
she
did.
was 325.
We'll keep them the same.
She loves her babies. 303. 303 up from 297. This is
Those
also
are good weight gains.
I know. Well, this is the first litter. I haven't had a single negative. I haven't had anyone drop or really plateau. They've had the biggest weight gain has been 25 grams in one day.
Wow.
That's crazy, right?
Yeah.
But they're still way smaller than the cupcake kittens. We're at this age. We're just as cute.
Well, she's kind of a petite cat in general.
She is.
She's not a. She's a giant cat.
And she had 7 in there.
Yeah.
Kind of cute.
And thankfully, usually birth weight depends on mom's size and not dad's.
Oh, I didn't know that. That's good to know.
Yeah.
And do you think the tapeworms, having the tapeworms so long, would have affected the birth weight too? Like if she had tapeworms till the end, that's why I put the baby gate up so that they can't get.
Maybe. you know, but at the same, I mean, she ended up getting great nutrition and she got
did.
deworming and
She got 16 days of
So-
good food.
yeah, so
They're saying thank you very much to you.
no, it's my pleasure. A good way to start the day. My husband doesn't really believe sometimes this is a real job. Very good. I know. You made her squeak. I'm sorry. Sometimes I have to do serious things. Oh, there you go.
So cute.
They just look so wonderful.
I know.
No, like seriously,
healthy.
like so they do. They look so healthy. Their body weights are, like their body condition is really, really good.
I was scared when they were born because they were very fragile. Like, especially Jitterbug was not very active, but
Yeah.
and he was born, his sac burst
just
at some point. But
So hardy,
they've really gotten strong.
but not poor. Like just perfect.
Perfect. Did you hear that? Perfect. She's the only one that doesn't have the crusty.
No upper respiratory problems.
And we tested Calypso for feline leukemia, thanks to Bobby's fund.
It's kind of cool.
I know. She's a unicorn, a torticorn.
I have a patient where she has that. She's in her late teens. It's stuck up her whole life. Like it doesn't lay down. And her name is Sassy. It's so cute.
Adorable. That's very cute.
Her mom always tries to put it to bed at just It's so cute. And she's a spicy cat. It's very awesome.
Spicy cat.
We love her. Wow, I'm so glad you guys are healthy. Yay! I know. I'm sorry. Should we get our calculator and give you guys a little dewormer? Why not, eh?
Yeah, deworming is fun. I just did Revolution on Calypso a couple days ago. So, so someone has a question about, do you have any thoughts about why Calypso doesn't pick up her babies? I think I have some thoughts on that.
What are your thoughts? Because you watch her,
Right,
her
because
real closely.
I've actually witnessed some, both incidents. Well, the first time Hula wasn't screaming, and she seems really to only be concerned when they squawk. And the second time I heard she was squawking, and I saw her get in and out of the nest, and then she went back in. I think she may have assessed that there was no imminent danger, and went back in. I didn't actually see evidence that she had tried to pick her up at all. She has actually come over, like when I've been taking pictures of a kitten and have them out of the nest when they were little. She came over and she tried to pick one up, or she went like she was going to pick them up, and then I put them back. But I think if she sensed that there was any sort of danger, or if she wasn't comfortable with the situation, she would have put them back. But
this isn't really safe. Like she does not look like she's stressed in any way, and there's nothing threatening for the cats.
Yeah.
So I don't think that she needs to. She probably just doesn't go into panic attack and start moving. And she doesn't have that kind of personality. Right?
No.
She's pretty laid back.
she's one of the more relaxed. Well, she's definitely the most relaxed mom I've had. Little tail in the upright position.
Okay. Mamba or Mambo?
Mambo. I think Mamba is a venomous snake. It is not you.
Yeah, about
So we start deworming at 2 weeks, and then we do every 2 weeks, ideally until 3 months. Of course, we only have them for 2 months, but
And we'll use different or Shelly often, or the shelter uses different products as they get older. This is a nice, safe, do no harm, and primarily it's getting roundworms, which is the biggest deal when they're this age. When they get a little older, it's nice to do something that also covers for tapeworms. But they're too young for the tapeworm products to use it safely unless we found we really, really had to.
And are tapeworms transmitted in utero?
No.
Okay, so only if they were to eat a flea that had the tapeworm eggs.
Or a rodent.
Or a rodent. That's unlikely to occur in this house.
It is.
Or at this age.
Your cats would beat it up at the door.
I know, can you imagine? They'd be like, lunch!
All the barriers. Come here, sweetie pie.
Down the hatch.
It's tasty, huh?
She's like, that's not what I usually eat for breakfast.
Good job.
All right. Remember when the first time we did this?
Did it go badly? I don't know.
With Kaylee, we forgot one, and there was a big.
Oh, right.
Thank goodness everybody was keeping track for us. Meow, meow, meow.
You guys even know what it's like to be syringe fed. You're so lucky.
Thank goodness I'm so lucky too.
Very good. I'm sorry. It's good for you. You would not get this on the street or in a barn.
Nope.
It's hard to be grateful at this age. You can't be self-involved when you're doing it.
It's trapped. So we do early spay and neuter and adoption at a minimum of 8 weeks and 2.2 pounds. And that's the Canadian Veterinary Medical Association's recommendation in the shelter setting. Because if we kept them 3 months, it would affect their adoptability and also prevent another cat from coming into the shelter, since we're a no-kill shelter. And there's no, maybe Dr. Ferguson can talk about this, but there's no evidence that doing early spay and neuter has any negative side effect
On a cat.
on a cat.
Yeah, it's a little more controversial in a dog because dogs, especially larger breed dogs, need to do a lot more growing. And they could potentially maybe get some other benefits, females with their urinary tract not being spayed super early. However, you have to do the risk benefit for shelter animals and the risk, just cutting down disease and animals that are out there homeless. And out here, there's viruses and coyotes and raccoons and a whole bunch of awful things that could happen to them. So it's probably, for population control, it's a good idea, and to decrease the spread of disease. And also, I really, in the past 5 years, the type of anesthetics that are available is amazing. So we can safely anesthetize them, do their spay or neuter, and also give them some good pain control for days after. And they do just awesome. Back on our website, and you probably posted them, they're having a snack about half an hour after their surgery. They're playing in their in the kennel with their litter mates, and they're just as happy as can be. So
That's something I've definitely noticed too, is when you do it young, they recover the boys are, by that evening, it's like it never happened. The girls take maybe a night, but they recover really quickly. Do you want to do mom too, or?
it's not going to hurt her.
Okay.
Yeah, I think it's definitely not.
Hey, mama, guess what? You get a little treat. Oh, such a good mama. Oh, such a good mama.
Do you like sweets? Because I don't think so. You're not supposed to really be able to taste sweet very well anyways.
Oh, sorry.
That was half of it. We did.
Doing an awkward hold.
No. I was trying to just see if we could be settled.
Oh. Do you want me to? I can probably get it from behind.
I was probably trying to be too nice and then you're hired.
That was a big mouthful for you. Yay! Like breakfast.
We can't really overdo our first house.
Do you want to see what someone made?
Yes.
These little catnip
Oh.
birds.
Oh,
She loved.
Did she?
She had so much fun with this thing. Ooh. That smells good.
Those are nice. They're fresh, eh?
I know. Oh, she wants. She
The
wants
whole
a big
thing.
box.
I saw a beautiful blanket that Praline came in with.
Oh,
A nice,
was it one of the cupcake blankets?
yes. Oh, that was very nice.
Oh, she wants this one in the box. So everyone's
check it out.
healthy. No,
No, they look really,
worries.
really good. Sean.
Nothing. No lumps in mom that you could feel. That's good.
Did she go pink? No.
She hasn't gone yet.
No, it feels very normal to me.
Good.
I don't think I would have any worries about that at all.
Good.
I think since she's
I don't
eating
feel
and
it now.
drinking, you didn't feel what you were feeling before.
No, it was when she was laying on her side, but it was very. It was very.
You might have been feeling a kidney.
It was like long and knobby and hard, like poo.
Yeah.
Like exactly
The
what you would
colon
expect.
runs on
Runs up
the
here.
upper surface, yeah, all the way along there. Sometimes it will kind of get pushed over by a full bladder or things like that. And sometimes with me, because if you're used to an experience, vets will sometimes to make sure I'll gently put a little pressure to make sure I can
Mhm.
squish it like this. Put it in
Oh,
there.
okay.
But it can be. I have occasionally sent cats home, seen them a day later to see if it's changed.
Yeah.
Because you don't want to do any drastic diagnostics if you don't have to, because it probably is.
Yeah.
But
Yeah, it was there for several days, but she was pooing regularly. But and then after I texted you, she had a big poo, and then it was.
she's a full cat. Like her colon's not empty right now either. Are you staying constantly full?
She does eat for 7. She does go through like probably 5 of these a day, plus her kibble. So that's good.
Yeah, she's not underweight.
Yeah, she feels. And she kind of like bounced right back. Sugar Plum was a little bit saggy for a while, a little bit flappy. But she's been doing her sit-ups. So are there any last minute questions? Let's see.
Guys, nice to see you. Did you guys got it?
Oh, Jitterbug, we didn't do the bug.
Oh, this one.
Thanks, chat. He could have had worms for 2 more weeks. No, we put it all away. I get distracted by their adorableness a lot of the time and forget what I'm doing.
When we do this, when we have litters of puppies or kittens come to the clinic, like often we'll move them from one to
Oh.
and then they just.
That's a good
But
idea.
it's nice. It's much more casual for everybody, but
This
it's
is like-
less organized. Yeah,
Right.
Sometimes. I know. Did you see your mom say no, thank you? There you go.
He's like, I thought I escaped without it.
Good job.
Oh,
Oh, I got it on your head now.
he's got a deworming mustache. A stringent mustache.
Awesome. Thank you.
Thank you so much for coming.
You're welcome. Thank you. My pleasure. See you guys in a little while. I sneak peeks though.
Yeah,
It's awesome.
because they're so cute.
Mm-hmm.
All right, we'll go back to kitten close-up.